Welcome to ESC TV. My name is Bernard Young from the Working Group on Valvular Heart Disease. I work in Paris, France, and I have the pleasure to interview Professor Keren from Jerusalem, who is the program coordinator of Group 3. Group 3 will be presented in Village 6. Professor Keren, could you highlight what is important in this Village 6?
Yes, Village 6, the topic Group 3 actually covers a large part of cardiology, representing the valvular group, myocardial pericardial diseases group, GUCH, and right ventricular and pulmonary circulation. We have many interesting topics, but the leading hot topics of these sessions probably will be related to percutaneous interventions in structural left and right-sided diseases and breakthroughs in the medical treatment of patients with pulmonary hypertension.
Dr. Keren, what do you think are the most important innovation regarding percutaneous intervention in structural heart disease?
The valvular group will focus on cutting-edge research and updates in clinical research in the two popular interventions of TAVI and mitral clip, and will present first data in animal experiments in percutaneous mitral valve replacement. In the same time, the GUCH group will focus on the right side of the heart with use of percutaneous pulmonic valve interventions and implantations in valve-in-valve, valve-in-conduit, and the new valve in native right ventricular outflow area. The myocardial pericardial disease will present focus sessions on pericardioscopy and epicardial biopsies and intervention in hypertrophic cardiomyopathy. In addition, they will also present their dedicated focus session to the new statement, first ever from the ESC, coming out from the ESC, on myocarditis, particularly performance and management of patients using endomyocardial biopsies.
And besides all issues regarding interventional treatment, what are the recent advances in drug therapy in this field?
I would particularly like to mention two sessions which should not be missed on new drug therapy in right ventricular and pulmonary hypertension patients, with right ventricular problems. The Seraphim and Chest-1 studies just recently published in the New England Journal of Medicine, pivotal studies which bring new drugs in treatment of this difficult disease entity.
So it's a very rich program indeed, and thank you for summarizing all these different issues, and thank you for joining us.
Thank you.
ESC Congress 365 is your free access to ESC Congress content all year long.